Another area for prebiotics, and it's been studied, is for the roles of prebiotics with individuals that have IBD. And when we think about IBD, obviously we already know that those are individuals that have a decreased barrier function. There's probably issues overall with the permeability of their GI tract. So there is a great opportunity for the translocation of various bacteria, antigens, and as the bacterial levels begin to grow, we have the release of various endotoxins, and it's those endotoxins that we see the effects with diarrhea. And ultimately, we have this revved up inflammatory response with individuals with IBD. So again, prebiotics have many roles where they can assist with minimizing these more detrimental barriers, if you will, with maintaining the integrity of the GI tract. So ultimately, we want to preserve the intestinal cells or those epithelial cells and also help with the inflammatory mediators. Certainly when you're in a very inflamed state, you can work with those inflammatory mediators or those cytokines with the inhibition of, for example, decreasing those pro-inflammatory mediators by inhibiting, say, for example, your NF-kappa B, which tends to be inhibited by butyrate. So again, going back to the role of those short-chain fatty acids. Also, the area of prebiotics with patients that have C. diff. We know that recurring C. diff can be quite a challenge with our patients. We know that there's this bacterial invasion and the release of various endotoxins. So again, as I've mentioned several times, the role of prebiotics by altering that environment, making it more acidic to help your defense against these detrimental bacteria, and ultimately increasing the role of the good bacteria to make sure that you have an increase in good bacteria to minimize the competition for those mucosal adhesions. On the next slide, what we're going to talk about are the potential health benefits that are associated with prebiotics. And again, this would be a look at emerging science. And the emerging science, what we're seeing today is improved mineral absorption. And we do have some studies looking at the mechanism of action by increasing the solubility and allowing an increase or enhanced absorption of calcium. And by that, we can decrease the overall pH because we're making it a much more acidic environment, which enhances this calcium absorption. And the reason that calcium is getting a lot of attention is because overall, we can absorb calcium throughout the length of the intestine because there's actually a second transport mechanism. It's considered to be a passive, non-saturable situation, and it is independent of vitamin D. So that's why we're starting to see some of the studies looking at, for example, Griffin looked at teenage girls because we know it's always a challenge to try to get enough calcium in their diet. Is there a way that we can enhance the calcium in their diet so that we can, overall support bone and growth development? So this is a new area that's emerging that we're starting to see more and more information. We do have some animal studies that are available, and again, there's some inconsistent data, but I'm sure that we'll start to see some new research going on that will further investigate the role of adding, prebiotics or as well as probiotics to enhance this environment, to increase the absorption capacity for the calcium. And also, I wanted to just address an area with prebiotics in tube feedings. And within the tube feedings, certainly there are some enteral therapy concerns, as always with these tube feedings. The one question that always comes up is whether or not there's this potential that they could clog the tube. And we certainly don't want to add to that. And one of the advantages with using prebiotics is that these are soluble fibers, but they are not viscous. So in other words, they don't contribute to the viscosity of the formula. So that gives them an added benefit where you can have these potential outcomes that are quite beneficial without worrying about clogging the tube. There's been no drug interaction noted within these particular prebiotics. And ultimately, the area of concern would be that of having gas or bloating or abdominal pain. And as I mentioned, typically we start to see noticeable side effects at the level of 15 but greater than 20 grams per day. So this oftentimes becomes dose dependent. Obviously, if it was something you were going to add to your diet, you wouldn't want to add all 20 grams at one time. You would be better off to break that up throughout the day. And also keep in mind the influence of chain length. Again, that FOS is going to promote more of the proximal area of the colon, and it's fermented more quickly. So again, maybe a blend of FOS and inulin will help to maximize the tolerance and minimize the negative effects of these particular prebiotics. And so briefly, I would like to identify probiotics. I'm sure all of you are familiar with it. Probiotics are the actual microorganisms themselves. And as far as the definition, these live microorganisms that when they're administered in adequate amounts will confer a health benefit to the host. So now I'd just like to concentrate for the remainder of the presentation on probiotics, so these actual microorganisms. Now, probiotics, in order to be classified as a probiotic, you have to be a microbial organism. It's very important that you remain viable and stable during the use and storage of these, of the handling, and be able to induce a host response, of course, as part of the intestinal ecosystem, and be beneficial to the host consuming the probiotics. So these are some of the basic criteria in order to be considered a probiotic. As far as their mechanisms of action, there's basically two categories. There's those that are non-immunologic, so in other words, this is where you're basically just maintaining a barrier or a defense for the more potentially pathogenic bacteria. You're helping to normalize the intestinal permeability, and favorably what you want to do is alter the ecosystem. So you want to make sure that there's a balance between the good and the bad bacteria. From an immunologic standpoint, this is where we have that effect with probiotics, with cytokine secretion, those inflammatory cells. So if need be, and you need to have more of an inflammatory response to fight against infection, this is where you could rev up or have this interaction between those T helper cells and those B cells and those other immune cells. And then even from the perspective of this cell-to-cell crosstalk, this is actually where the intestinal epithelial cells of the host play a role in processing signals that are given by the bacteria. And this is actually based on the continuously changing intestinal content. So there's various signals that are released that influence overall messages, and there's various expressions of these specific molecules that go back to release of various cytokines. So this is another newer area that we're identifying as far as from an immune response and the effects of probiotics. And then ultimately we're modifying the structure of those potentially harmful antigens, which of course is another beneficial effect that we have by adding just probiotics to the diet. So how do we identify probiotics by name? Well, actually, the main category, if you will, would be lactic acid bacteria, and I'm sure all of you can guess by now that that's because when these probiotics or good bacteria ferment the prebiotics, they release lactic acid. And we have two main categories of good bacteria that have been widely researched, and that's bifidobacteria and lactobacillus. And I just listed some of the species within those genera so that you could identify. I'm sure many of you are familiar with Lactobacillus acidophilus, as we see that oftentimes in yogurt, and Lactobacillus GG, which is a common name for the bacterial strain Casei. So again, the GG actually is just kind of that nickname because this was a particular bacteria that was discovered by two doctors. It was a Dr. Golden and a Dr. Gorbach, actually back in 1985, so hence the name Lactobacillus GG. As far as the characteristics of bifidobacteria, these probiotics are gram-positive rods. The bifidobacteria are Y-shaped, whereas the lactobacillus are rod-shaped. They're both naturally present in humans and do meet that probiotic criteria.